I spent July of my 5th year of life in that pediatrics ward as a patient, and I will, to this day, I remember how hot it was at night, in the month of July. It was pretty interesting. So then my first office was right down the hall from where I spent that month, but it all looked pretty different from me with all that vantage point of time in between. I had a strep infection that went to my kidneys, and it's called nephritis. And during that summer, there were 3 or 4 children in my community, and so I don't know what was going on. I just don't know the etiology of all that, but we were all hospitalized at one point or another, and usually those hospitalizations lasted, I was in there for a month. Yeah. Unheard of nearly today, unless you're, a child in pretty serious medical condition, and that's not to say that I wasn't, but in retrospect, I think I spent most of my time wondering why the heck I just couldn't get out and go play. Yeah. I had a Leave It to Beaver childhood, grew up in Centreville, great little neighborhood, lots of kids my age. We all went to school together, we all waited at the bus stop together, got into the usual shenanigans that kids roughhousing at that age do, and graduated from the high school there in Queen Anne's County as the first, our distinction being the first class to go all the way through the new comprehensive consolidated high school, Queen Anne's County High School. So we went from our smaller regional high schools to one regional high school. I graduated from there. I had spent my entire youth in that one town and that one house that my father built. Wow. And said, I'm getting out of Dodge. But I do remember going away to college. I didn't go too far away, and I didn't go to too much larger of a town. I went to Frederick, went to a women's college, started out as a women's college, became co-ed shortly thereafter. But coming home from there, my first trip back to the shore after being away for all of about 60 days, right? I came across the Bay Bridge, and there's the shore sprawled out ahead of me, and I felt tears come to my eyes, and I realized then, I could sort of get choked up now, I realized what a beautiful place this is, and how much I probably had taken it for granted in wanting to look at it in the rearview mirror all of those years. When an opportunity popped up, I was working in communications at Chesapeake College, and somebody brought this ad to me from the newspaper and said, you ought to apply for this. And I took a look at it and I said, nah, I don't think so. And the more I thought about it, I thought, well, it can't hurt to apply, right? So I found myself not too long afterward sitting in the office with the late Nick Ryasich, who was the president of the hospital here in Easton for a long, long time. And we had a great conversation, and total surprise to me, he offered me the job, and I didn't have to think too long about it. I loved what I was doing, but this was a great opportunity. Yeah. And so I jumped in, and it's been a fascinating experience, including moving from the office that was near my childhood confinement to this great space here. I would say that probably my connection, like so many people in this region, our connections to the healthcare organizations that we work for run really deep and generational. Our family members were nurses, physicians, worked in the hospital in some capacity. When your largest employer in a community is one of the healthcare facilities, then you tend to develop those legacies. So, my grandmother was a nurse, my aunt was a nurse, my sister was a nurse, and my sister I always tease her and say there's no such thing really as was a nurse. You might be a retired nurse, but you're still a nurse. we learned how to run hospitals, and then we learned how to become systems, and then we learned how to become part of bigger systems, and how in doing each of those things, how to retain, at least work hard to retain, the things that are unique and special and important about this place we call ours.
Yeah.
Whether it's the shore or our organization, even the uniqueness of our individual pieces of our organization. And I'm not just talking about the hospitals per se, but we're spread out over 5 counties here at Shore Regional Health, and each place has a uniqueness, while still I think there's a pretty nice pride in being part of University of Maryland Shore Regional Health.
Yeah.
How in some ways it's back to the future. I grew up, as I mentioned, in a small town, Centreville. And we didn't call what we did regionalization, but I had family members in at least 4 of the 5 counties that we serve here. And it was nothing to just pack into the car on Sunday and ride in one direction or another. It was nothing for me to spend weeks at a time on my aunt's farm in Chestertown, or my uncle's place in Denton, and we thought nothing of driving for things. What we didn't drive for were the things that were right in Leave It to Beavertown. We had 3 grocery stores, we had a movie theater, we had a jewelry store, we had 2 shoe stores, we had a dry goods store and a department store where you could get all kinds of things. We had restaurants. All these things were right in downtown, right? Yeah. But we drove, and we had 2 or 3 physicians practicing, family physicians practicing right in town. Mm-hmm. We drove for anything that required more intensive testing, medical testing. We certainly drove to be admitted to a hospital or go to an emergency department. So I think that the balance of having what you need close by, and what you need in day-to-day life close by, and what you need less frequently within regional drive time, is not a new notion at all. I remember being astonished when the birthing center at Dorchester Hospital was closing, delivering very few babies a year, and sort of a mirror of what has gone on at Chestertown in more recent years. Folks were very emotional, and understandably so, about not being born in their county anymore. And I realized for the first time for myself, because I just never felt that distinction. We didn't have a hospital. We don't have a hospital in Queen Anne's County. I was born in Talbot County, and that was just a fact of life. I wasn't born in Queen Anne's County, but I lived there, and I still think of it as home in many regards, although I haven't lived there in decades. So I understand and appreciate the emotion that's attached to things like buildings and where my children were born, and maybe cases of where someone passed away or where you spent a difficult time in your life. Those are things that we all focus upon. And ask me what the big misperceptions about healthcare are. And I'd say probably not so much a misperception, but part of the change that we're in as an enterprise, not just ours, but healthcare nationwide, is the shift from inpatient care to outpatient care to managing chronic disease, so you don't make 5 trips to the emergency department because your blood sugar's not under control, your blood pressure's not under control. These are these are teachable, learnable, manageable, largely conditions that we now have a responsibility, along with primary care physicians and your health insurance plan and, everybody responsible for helping you learn to manage your chronic health conditions so that you don't get readmitted to a hospital unnecessarily for the same thing, or go to an emergency department multiple times for the same thing. Healthcare is shifting dramatically to the outpatient side, and it's happening whether you and I want it to happen or voted for it to happen or buy into it happening. It started happening long before things of recent note as a trend. And part of it is technology, part of it is knowledge, part of it is pharmaceuticals, part of it is simply the per capita cost of healthcare in this country is astronomical, and it is not sustainable. It's not sustainable the way it's been. And I don't care if you define the way it's been going back to 1985 or 1945 or whatever, but it's not sustainable in its current structure.